Welcome everybody. This is our third tutorial on first aid homeopathy, and today I'm going to be talking about cuts, scrapes, lacerations, and the most useful remedy one can take before and after surgery. The name of our remedy today is Calendula officinalis, and I have a nice picture of it here for you out of this little book. So there it is. It's also called the marigold flower. And you would think perhaps, a little lowly flower like that doesn't have very much importance in our world, but actually it can be a real lifesaver, because the reason for that is that cuts and scrapes can become infected, and that infection can spread, and it can take over the whole body and lead to death. So I had a patient like that once. He had had surgery in his knee for a meniscus tear. So they took that out, and somehow some bacteria got in there, and the whole knee swelled up, became lost its circulation, and they tried different antibiotics. They tried opening up the knee and putting antibiotics in there, and the infection just got worse. His whole leg swelled up. Circulation became compromised. His whole body started turning gray. And his wife called me one night and said, "I think my husband's dying." So I gave him Calendula 30C about 3 times a day. And within 24 hours, he started to improve. He started to feel better. And he went on to make a complete recovery. This perhaps brings up a little bit of a subject of dosing, which we could talk about. The safest way to do dosing is that you can repeat the remedy when the symptoms start to return. So, for example, the arnica remedy that we talked about, if someone has pain from an injury and 6 hours later or 12 hours later the soreness comes back, then you can take the remedy again. Same with the arsenicum remedy. If someone has gastroenteritis and they have nausea and they take the remedy, and an hour later or 2 hours later the nausea starts coming back, then it's completely safe to take another dose. And you can keep doing that as long as until the body finally recovers. If it doesn't recover with a 30C and you've given it 3 or 4 times and it keeps relapsing, then you're justified to get a 200C strength, which is about 4 times stronger, and take 1 dose of the 200. And if that keeps relapsing, you can take the 1000 or 1M strength, and again keep giving that as long as when the symptoms return. Another reason to justifiably take another dose is if someone is plateaued, so they improve 20-30% and then they plateau for 2 hours a day, whatever, 2 days, it's just the same symptoms. Then as long as you're sure that it's on a plateau and there's no more improvement, then you can give another dose and it'll start moving up again. And then if it hits another plateau, give another dose. So either a plateau or the symptoms get worse, justified to give another dose. If you give 1 dose and the improvement just continues all the way, then you only need to give 1 dose. So I would say about half the time with first aid situations, the patient will only need 1 dose. Sometimes there's an underlying susceptibility, which means that the person already had an inherited weakness in that area. So if they already had an inherited weakness towards infections from cuts or scrapes, then they're starting at a much lower point, and it's going to take a few more doses to get them all the way back up. The other reason to give this remedy is just for the pain. So if it's a child and they scrape their knee from a fall or something like that, then you can take Calendula as a remedy, 30C strength, or you can take it as a cream, or in this case it's mixed with beeswax, and you just kind of rub it on the skin, and it'll stop the pain and start the healing process. Or you can do both. You can take the cream and the remedy internally, and they will both help. There's some other examples. So one time I was sharpening an axe, and at the very end, when it was very sharp, somehow my hand slipped and it onto the sharp axe that was all dirty and covered with oil and who knows what else, and I sliced my finger pretty badly, pretty deeply. And so I cleaned it right away, and I put calendula on it and took some 30C. And the next day I took the bandage off, and there was no dead cells. There was no white cells or anything like that. I still have a little scar from it here, but it just healed up and the tissues all came together and the pain was gone, and it went on to do well. I have had quite a few patients in the last 25 years who needed calendula, and most of them I give them before surgery to prevent infection, and so you just give one dose about 3 to 6 hours, or you could even give it 12 hours before the surgery. And then you can give it right after the surgery, and then once a day for 3 days, which would be totally fine, just to prevent an infection from coming on. And actually with that protocol, I've actually never had a patient get an infection after surgery. If this was a common use in hospitals, I think the rate of infection and mortality from infection would go way down. Right now in the United States, there's about 120 to 140,000 deaths a year for patients that get infections after surgery. So many of those, I believe, could be prevented by taking this remedy. It's interesting that if someone does have a very slow healing response to a wound, that later on it can start to cause chronic problems, and sometimes these chronic problems can be taken care of with this remedy. And what usually happens is that wherever the surgery was, the area will become kind of red and inflamed and sort of touch, and then it can kind of spread. And as it spreads, it starts to produce a type of anxiety in the patient that somehow this is going to cause them to die. And so they can even wake up in the middle of the night with a panic attack, or during the day they can have a sudden panic fear that something bad is going to happen and that they're going to die, and they might convince someone to take them to the hospital, and they'll check them out and they'll say, well, you're having anxiety, but you're not going to die. And so if somebody has a history of not healing well from a wound or not healing well from surgery, and it ended up being a generalized inflammation with soreness about it and that type of thing, then this remedy, I've seen it work quite a few times for that sort of overall condition. Anyways, I hope you've enjoyed this short video. If you take calendula, or you give it to someone and they don't respond within a few hours, and it's your judgment that somehow this is a dangerous situation, I would still recommend you get them to a medical doctor or a homeopathic or naturopathic practitioner to get another opinion on it. And if they're having any trouble with breathing, or something seems more serious going on, then definitely call 911, get them to the hospital, find out what's going on. But 98% of the time, if someone has a wound, a cut, or a scrape, you can take some calendula or use it locally on the body, and the next day it'll be completely fine. Anyway, thank you, and bye for now.